Hello, I'm Salome Tibabu, the host of the Going Digital Behavioral Health Tech Conference. Super excited to have Dr. Brett Hart here with us, Chief Behavioral Health Officer of Centene. Welcome, Dr. Hart.
Thank you so much for having me. It's a real pleasure to be here.
Can you start off by introducing yourself?
Certainly. As you mentioned, my name is Brett Hart. I'm the Chief Behavioral Health Officer for Centene Corporation. I'm a licensed psychologist and have about 22 years of leadership experience in the managed behavioral health industry. And prior to entering the managed health field, I was a medical psychologist at Washington University School of Medicine and worked in both psychiatric services and with organ transplant teams. And last thing I might mention about myself is I have a real passion for teaching and supervision, and have taught at the college and graduate level for about 17 years as an adjunct instructor.
Excellent, thanks. And can you also tell us what is unique about Centene and the members you serve?
Sure. A little bit about Centene. For folks who may not be quite as familiar, we provide services to more than 25 million members across the nation. Most of those are individuals who are underserved or at risk. We insure about 1 in 15 individuals across the nation through Medicaid, Medicare, marketplace products, as well as the TRICARE program and also correctional institutions. And some of the ways that I think Centene is unique is, first, we're the largest provider of government-sponsored health plans in the nation. Because of that status, we have a unique privilege to serve our nation's most vulnerable citizens. And those individuals really typify our overall membership. We also recognize that each state, each locality, each family, each individual is very unique. So collaboration is really the key that we use in removing barriers to health and providing access to care for each individual. Because of that, we're unique in that we utilize a local approach to support our members and providers and customers. And finally, I'm convinced that we're unique in terms of our mission focus. While just about every company will state that they're mission driven, our mission really permeates every action and decision we make. And you'll detect that mission in a very tangible way in our people, in a way that really differentiates us in the industry.
Thanks so much. So we're a year into the pandemic. How has Centene evolved to meet the needs for members through this difficult time?
Well, this has definitely been a tragic and costly pandemic. If there's any silver lining anywhere to be found in this, I think it's the fact that there's been such a significant push in innovation in behavioral health care. As we know, rates of mental health conditions, substance misuse, suicide have all skyrocketed during this COVID pandemic. So it's really incumbent on us to be relentless and evolving to meet the needs of those we serve. While certainly not unique to Centene, we, along with many others, have dramatically expanded our telehealth access to services for our members, including telehealth access to substance treatment services. We've seen how critical this expansion of services through the telehealth medium has been through our claims, which interestingly enough show that 9 of our top 10 diagnoses treated in a telehealth context are behavioral health conditions. We've formed new unique partnerships with technology and clinical innovators to deliver specialized digital services to our members, and are assisting our members to overcome barriers to care in a lot of novel ways. Some other key ways in which we're evolving as a result of the pandemic is that we're providing training for providers and community members as well as our enrolled members on actions to take when faced with mental health and substance use issues. We've donated to the National Council for Behavioral Health's COVID-19 Relief Fund to expand the provision of mental health first aid. That's a teletraining which teaches people to recognize signs that someone might be experiencing a mental health crisis. At the height of the pandemic, we announced a partnership with AT&T to offer healthcare providers expedited access to the federal FirstNet network, which is a nationwide wireless broadband service. In addition, we've partnered with Samsung to distribute smart devices to providers, particularly in rural areas, to distribute to members so they can participate in telehealth services. We also know there have been health disparity challenges. So we've partnered with the National Minority Quality Forum and Quest Diagnostics and the Minority and Rural Health Coronavirus Study. And that's a study that examines the impact of COVID-19 on racial minorities and creates a foundation of a plan for decreasing the disparities. And then the last thing I might mention is that because we work hand in hand with our provider network to deliver care, Centene partnered with the Association of Clinicians for the Underserved to develop a suicide safer care curriculum and toolkit. And that's to train primary care providers on suicide risk assessment and intervention based on the zero suicide framework.
All of that is remarkable. Can you tell us a little bit more about what Centene is doing to support the behavioral health of your members?
Certainly. You know, when you serve 25 million members, meeting an individual's behavioral health needs really starts with getting to the actual individual and understanding that person's unique needs. You know, what makes them tick, what the world looks like to that individual. And we certainly do that through our people by outreaching our members, getting to know them, understanding the challenges they face, developing solutions that uniquely meet their needs. But we also do that through our technology and our analytics. For example, we bring artificial intelligence and predictive modeling to bear to detect behavioral health risk factors and comorbidities very early on in the healthcare process, or even before the individual may be aware of the presence of a behavioral health condition. We also work extensively with primary care physicians and other physical healthcare providers to detect behavioral health conditions that might otherwise go undetected. We pay very close attention to the unique behavioral health access needs that our members face and are meeting those through new technologies such as telehealth and digital solutions that travel with the person versus the person traveling to the services. We also understand the sociocultural challenges that face our members and come alongside them to remove those barriers, such as transportation challenges or lack of housing, food insecurity. We recognize that vulnerable and underserved members we serve should not have to settle for second best. So we partner with leading technology partners and innovators to provide our members with cutting edge solutions to their conditions. And examples of that include things like delivering care in schools or delivering through remote technology. We're also designing population level programs for our members across the country. And last, I'd mention that we're actively working with policymakers nationally and even internationally to ensure that our members' behavioral health needs are at the forefront of their policy recommendations.
Really wonderful to hear all of this great work. Can you talk about what's unique about delivering behavioral health services to Medicaid populations?
Certainly, it's a really good question because I think oftentimes that's a consideration that people don't factor in. And certainly the issue of access to behavioral health care is unique among Medicaid populations. This is closely associated with the fact that Medicaid populations also experience more social determinants of health that we must keep in mind as influencers of health outcomes. So, many of our members, for example, may be homeless. They may face uncertain housing circumstances. They may have limited transportation options to reach a care delivery location, or they may just not have technology or even broadband access. So these individuals may also be more vulnerable to medical behavioral comorbidities, and therefore detection of those conditions and integrated approaches to address needs in both areas is really critical. And we place pretty significant time and energy and resources into ensuring that these individuals are able to access the behavioral health care they need. Um, this is an especially unique challenge in rural areas, as I mentioned a bit earlier, and in underserved urban communities, but also a unique challenge with respect to securing certain specialty services, such as child and adolescent psychiatry.
Given Centene's model with individual plans nationwide, what are some important considerations when attempting to deploy new behavioral health initiatives?
Good question. As any global company does, we look to deploy innovative and integrative solutions with immediacy and scale. The concept of piloting is crucial to us. For example, we may pilot an initiative in one market, then using evidence-based practices and the lessons learned from that market, we're able to execute across other plans in a successful manner. And what this really enables is that we can continually pilot dozens and dozens and dozens of new opportunities at a time without really exhausting the resources of any one health plan or any one group within our organization. The individual plan structure also allows us to deploy solutions in a very targeted manner to specific populations that will benefit the most. Technology platforms are also critical. We design and adopt clinical and technology platforms that will allow all of our individual plans to bring the integrated health picture into full view for themselves, for providers, and for members, and really push recommendations to providers to address the holistic needs of their patients. Uh, Also, our individual plan structure demands that we build effective relationships with our communities and understand the unique needs that those communities face and design solutions that fit those needs versus a one size fits all national solution.
So, we have a lot of digital behavioral health startups in the audience here. Many of them want to partner with Medicaid populations. Do you have any advice for how they could better work with someone like a Centene?
Yeah, this is a really, really exciting time. And I just want to say, first of all, how grateful I am as a psychologist that we have such an interest from startups and venture capital funds in behavioral health solutions. You may agree with me that 20 years ago, I think it would have been difficult to find a startup interested in behavioral health care or a venture capital fund eager to invest in a behavioral health solution. But today, the level and the amount of innovation being poured into behavioral health solutions is really astounding. We're seeing such creativity in terms of how individuals access care, when they can access it, self-service interventions, gaming solutions, first responder support. I mean, it's really a rare moment for behavioral health in terms of enjoying a consensus around its importance and some of the most creative minds helping to develop advanced solutions for those in need. So, to those individuals that you referenced, I would say first, it's important to look beyond financial savings that a solution might generate. This certainly isn't to say that financial soundness is not important, but Payers like Centene are looking for solutions that not only enhance member outcomes, but also improve overall quality. I'd say it's also important to us that solutions are accessible and practical. Our members are underserved. They may not have technology access that others have. They may not have a home, or they may face any number of other challenges. So the solutions that might work for a commercially insured population may not work for a Medicaid population. I would also ask myself the question of whether I'm introducing a standalone solution, or does my solution help address the fragmented nature of healthcare and bring together various components of the healthcare ecosystem, or at a minimum connect with them pretty seamlessly. Um, Other considerations I think include, is my solution cost effective? Am I capable of entering into a value-based arrangement? Does my solution create a really effective and simple member experience? And then last, and maybe most obvious, but I think it's probably worth mentioning anyway, is a startup should really keep in mind the cybersecurity requirements that a healthcare company requires by ensuring that their solutions mitigate any threats to PHI, and ensuring that they're HIPAA compliant.
Well, I don't know if I can comment on the change since 20 years ago, but definitely a lot of interest in VC and startups these last few years. Um, I'm excited to hear more about where you hope to see the future of behavioral health service delivery go, and changes you want to see in this front.
Yeah. And I guess I dated myself on that last comment, but no, really, really good question about the future. I'm really hopeful that we'll continue to see the growth of a consumer-focused behavioral delivery system in the future. I personally, I think for too long, behavioral health has been seen as a somewhat mysterious or veiled service that's often obtained in a brick and mortar office with predetermined, well, a very predetermined way. I'll put it that way. I think behavioral health care really needs to meet the consumer at the point of their need. In my view, this really starts in the training programs in our country, and extends to a wide range of health professionals who can detect the presence of behavioral health care needs. We really need to equip individuals with the ability to obtain behavioral health care on the go through self-service, digital solutions, apps, gaming technology, tele-enabled means. We also need to ensure that individuals have 24/7 access to behavioral health care. Uh, they need that access through avenues that are more sophisticated than just going to an emergency room. Also, I think the behavioral health care delivery system needs to be easy to use and understandable. If each one of us in this audience stops and thinks about how easy it is, or the lack of ease in using the healthcare system, now try to imagine doing that if you're an individual with a severe psychiatric illness. We really need to come alongside these individuals and help them navigate the system. I think we also need better support of our providers in the healthcare system by pushing relevant behavioral health data to them versus expecting them to go searching for it and trying to assess it directly. And realizing that behavioral health care is no longer the domain of the mental health professional. And I know that may sound a little odd, but when we think about the fact that upwards of 80% of mental health care is delivered by primary care physicians, we really need to make sure we're supporting those individuals with data and insights being pushed to them, supporting instant consultation, supporting them by helping them find appropriate referrals. We also have to make behavioral health care more affordable. My view personally is that this is going to happen as technology and self-service solutions become more readily available. But affordability is really critical. And then the last thing I might offer is I really hope we become much more detection focused in behavioral health care. Currently, behavioral health care is largely reactive and responsive to the emergence of conditions. But through things such as predictive modeling and AI and detection strategies, I think we really have an opportunity to address needs before symptoms even emerge. And this is really the ultimate win-win strategy in that it really prevents individuals from suffering. It's cost effective, it reduces impact on families and societies, and ultimately seeks to preserve wellness and health.
Awesome. Super exciting. Thank you so much, Dr. Hart. I really wish we had more time. This has been very helpful and insightful. Really appreciate your time and expertise today.
Well, thank you so much. And it's just been such a pleasure to be a part of this, and can't thank you enough.